Okay. Oh, forgive me. Can I commend the member for Manchester Withington? This is a really, really important debate, and I think he's just made a wonderful speech that has stepped through lots of the dynamics in this debate. It's a genuinely difficult topic, and I think there's lots of people here today who wanting to participate and to demonstrate the care, the compassion, the concern about the individuals at the heart of this. And I think that's kind of one of the themes of what I want to talk about. To me, I think this place is a funny one. It can be quite fraught and not necessarily obvious to those observing outside this house how members here have to balance our compassions for any given individual human being with the office that we hold and the responsibilities that that brings. And whilst I actually want to talk to a number of the points that he's made, I also want to speak today to kind of highlight how difficult that trade-off can be for members. You know, since I joined the House in 2019, I've sought, where possible, to kind of find a way of speaking English to make these debates in a normal way. And I'm going to try and do that on this topic. But I don't think when I first pitched up, ever really understood the nature of that trade-off. And I think bills like the Honourable Gentleman's here today on this topic really land at the heart of, this is not necessarily a particularly easy or comfortable thing to talk about. So I'm going to try and stick with what I promised and try and use some real-world examples. So with the House's permission, with Madam Deputy Speaker, I want to highlight the real-life experiences of one of my constituents in South Ribble, a redoubtable lady by the name of Joanne Griffith. Now, Joanne's a wonderful individual, but this is really about her son, who she calls Boisterous Ben. Ben, has great difficulties with his epilepsy. He's struggled with treatment over the years. And before I kind of start to highlight the case and understand how it pertains, in a bit of clarity for the House, Joanne does not support the Conservative Party. In the past, she's been on a leaflet with the Honourable Member for Islington North. And I'll highlight this not to make a party political point, but, MPs on all sides, those opposite, when we're elected here, we are here to support all of our constituents and take that job really incredibly seriously. So I think, as per my earlier remarks, I want to put that on the record. She will never, ever vote for me, but I'm going to speak genuinely and honestly, and I hope in the way I can, her best interests. So, and in these more febrile times, I actually think that's quite important. But let's get back to the important, which is Joanne, and more importantly, her son Ben. So I want to put her efforts for Ben on the record, and so the easiest way to do that is to just quote her in her own words. It has been 3 years since the law changed, and I have spent 4 years fighting for access to what is very much the only medication to have any effect on my son's hundreds of life-threatening seizures per day. Medical cannabis has transformed his life and given him seizure freedom, and we do not wish any other parents or child in the area to go through what we have and are still suffering. When I was elected back in December 2019, you get permission, to explain to members watching, you get permission from individuals and you can take on casework from your predecessor. Now, often that comes due to the complexities of the systems, that comes in printed and paper form. And I was given a pile of handouts that was that big, and I was given one file. And I'm telling you, it must have been 1.25 inches thick. When Joanne says she has been campaigning for 4 years, she has been campaigning for 4 years. I didn't so much pick up that file as weigh it. And if any given set of paperwork can kind of describe an emotion and the passion that this debate arises, it's just that sense of, there you go, congratulations, you've just won an election, help this lady and her family. And within that case file is letters, meetings with her local MP, my predecessor, but she's met with government ministers, she's met with pressure groups, she's met with policy research, she's been tireless campaigner. She even had members of my predecessor's staff attend appointments with medical professionals with her. You know, and reading that and reading the on-correspondence, I want to put on record and I want to state confidently that Ben could not have a better mother. She is not a tiger mum. She's like a proper lioness defending her children and defending her son. And I think it's really important that I put this genuine admiration on the record for the House today. She's fought tooth and nail for him. And the question I think I want this House to examine in the light of the bill that Ben's put forward is this a way for her to, should she have to be that lioness of a mum? So I will just give you a highlight of what she's done over the last 4 years. This is by no means the all of it. But she's fought for medical cannabis to be legalised. She's met with the Secretary of State and Health, and all members of this House know that you don't suddenly turn up on the Tuesday with that idea and then it happens on the Friday. That takes a lot of time and effort and engagement. She's then, along with others, helped secure the legalisation of certain types of medicinal cannabis. She's then fought her way through a system that's not really understanding of it, to see a medical professional, to see a specialist. And then in 2019, she's got Ben prescribed the Bedican oral solution, which is the 20 milligrams, 1 millilitre THC 2%, as well as the Bedrolite oral solution, 100 milligrams, 1 millilitre CBD, 10% THC, through a private prescription. And this is Joanne in her own words again. For years now, we have had to fundraise up to £2,500 a month to fund this medicine. We use all our savings and borrow money from family and friends. We are on the verge of being broken, both financially and emotionally. Due to the stress with COVID, our fundraising options have all been shut down. This is on top of running a local business while looking after a child with complex needs. That speaks for itself, really, doesn't it? So let's address the efficacy of the treatment. Ben's response to this treatment was recently described by the IFR panel, which the Honourable Member for Withington mentioned, as exceptional, with demonstrable improvements in his condition. So that's an independent third party, effectively talking about the fact that this works. So Joanne is still going, because she still is on that private prescription. She's fought through the NHS system to see a specialist and get a clinical decision to agree Ben's prescription, and with the implication that that would be funded through the NHS. She's then been rejected by the local CCG on hospital trust policy to get that prescription given. She's now, the lioness mum that she is, back in my inbox and in lots of other people's, campaigning to understand what caused the blockage in the prescribing, what's happening, she's got the Secretary of State has instructed, she's campaigned and she's got the Secretary of State for Health to, instruct the NHS to review what's causing the issue, what's causing the blockages. The questions are being asked in the highest departments. She's written to the Health Select Committee about this. Delighted to.
Describing a person and a child that I know very, very well as the co-chair of the APPG on medicinal cannabis and the prescription. Joanne deserves better. Ben deserves better. I am so pleased that we are seeing through the party politics here and that you have met with Joanne, because this is a ridiculous situation. You are describing 4 years of hurt and pain and fighting of the lioness that is Joanne Griffith, and yet nothing has been done. And it really upsets me, and I'm glad that she is on side here. But please, we have to find a way forward. You are the Honourable Lady is on the government benches, and this has to change.
I thank the Honourable Lady for her intervention. I agree with you, and I'm going to come on to... I agree with the Honourable Lady. Might as well get something decent on the record. Madam Deputy Speaker, you can take the girl out of the north of England. I apologise profusely. But I agree with my honourable friend. But I'm going to come on to why I'm not... I think there are some genuine issues that kind of prevent immediate kind of do-something action. And I do genuinely want to examine them. Well, no, let me come to... I'd happily take another intervention once I've gone through it. But I just want to continue to highlight what this lady, Joanne, is having to do. So she's got the Secretary of State to go and ask the NHS what's going on. She's still along with other parents talking to the chair of the Health Select Committee, who she had previously met along with Ben in his role as the Secretary of State at the time. Now, as per the advice from the local CCG, she's applied for an individual funding crest, an IFR, with clinical a prescription and a demonstrable improvement in boisterous Ben's condition, and got rejected. So she's now in the process of, she's appealed in July, won the appeal, and then on the 3rd of November, the appeal process has been deferred, awaiting further clarification and more information. And as the honourable member opposite highlights, that just has got to feel Gordian if you are in Joanne's position. It's how on earth do you unpick this? So, she's still fighting. I as you would expect, supporting, and to a point that the honourable member for Withington raised. I've also written to the Secretary of State about an observation trial and participation within that. This story is distressing. I can't see anyone on these benches that is not moved and thinking of what they would do in a similar position. But it is complicated, and I find it really, really hard to reconcile my personal distress.
And I thank the Honourable Lady for giving way to me again. And when she says it is complicated, it is indeed complicated. But we are now in a situation that is ridiculous. There is someone in the system that is blocking the medicinal cannabis getting to these children. There are already 3 prescriptions that are being supported. Why can't the others be supported?
Thank you, Madam Deputy Speaker. I think the honourable member raises an important point, and I'm going to come to it because I think what's happening is these individuals are caught in a pincer movement between scientific proof and medical ethics, and I want to touch on both. Now, I'm mindful of the honourable member who called the debate's challenge to say, well, if you can't do this, what can you do? And I want to make some suggestions in that space. I think the issue, the distress is genuine in there and clearly felt on both sides, but it's the specific definition of practical actions that addresses the situation that I find a problem. So if you forgive me, I'll just kind of set it out in order. So since November 2018, the law allows for prescriptions of medicinal cannabis, which is no small thing. It's been an illegal drug for a long time, and it's those on these side of the house and those benches that brought that in. It's a legal tool of prescription. It's a tool in the armoury of qualified doctors. Now, prescription medicine is rightly the preserve of highly qualified, trained doctors. You would not want me kind of wandering down the high street saying, oh, you look a bit poorly today, go and have a bit of that. It takes years and years of blood, sweat, tears, and ultimately the doctors, when they've completed that technical qualification, take the Hippocratic Oath. And for me, I think today's debate hinges around the interaction between that Hippocratic Oath that doctors take as an individual upon qualification, or the general, I don't know, I'm aware not everybody swears on the same text. And this House's ability, or more specifically this government's ability, to feel qualified enough to influence or seek to influence the decisions that the doctors take. I think that's where the blockage is. But the honourable member, I give way to the member opposite, and then
And again, the generosity for allowing me to give for giving way is noted. But on that point, is the member trying to say, is the honourable lady trying to say, that those prescriptions that have already been written by experienced clinicians privately are unethical?
Okay, so the honourable lady opposite needs to perhaps just let me make some of my points, because she keeps asking me, and I am genuinely trying to get there. But if I've also promised that my honourable friend could come in.
I'm very grateful to my honourable friend for giving way, and very grateful to the honourable member for Manchester Withington for bringing forward this important debate, and he spoke with power and passion about a very important issue. I just wanted to touch on the comments you made about the difficulties in decision making for clinicians in the front line. And I speak as a veterinary surgeon cognizant of the difficulties in making rational evidence-based decisions on the evidence that you have. And in our profession, the difficulties when you are looking at licensed products for the species that you're treating, and then the tough decisions that are made when you go off license. So I'm very, very sympathetic of my colleagues in the medical profession that they want to have a large evidence base to make them feel comfortable making those decisions. Would my honourable friend agree with me that it is welcome that indeed that NICE have made some recommendations about some trials that can take place, and that there are trials underway, and that will try and help us improve and increase the evidence base to help clinicians in the front line make rational decisions?
I thank my honourable friend for his intervention. He anticipates a couple of points I was also about to make. But I think it's not just that individual that's prescribing that I'm talking about. It is the medical system. So it's not, you know, there are, rightly, in our wonderful NHS, medically qualified people engaged in lots of layers of, as my honourable friend from Gedling may have the bureaucracy, but you know there are people with the Hippocratic oath. It's not just the person that's on the one-to-one with the patient; it's all the way through the system, and that's maybe the point. That's what I'm worried about, basically. Of course.
So I think where she's in her speech, she's absolutely on point about the challenge that faces us, and of course. The medical profession wants a reliable pharmacopoeia to be able to turn to with all the supporting evidence and the rest. The problem our profession has inflicted on our constituents is that we're 50 years behind in the research here. And outside the regular pharmaceutical assessment has gone on all the knowledge that's on the street, that is unreliable, but it's there, and so people believe this medicine works in all sorts of ways, and the responsibility we've got in place, and then obviously turning to the criminal supply chain to get it. That is our fault, and what the honourable member is trying to do is to find a way through this so we can actually get the service to patients that they deserve. And that's why I think this bill, at the very least, deserves a second reading so these issues can be pursued in committee.
I thank my honourable friend for his intervention. I'm not sure I completely agree with him on the translation. I think almost he makes my point for me in that he's talking about the ubiquity of cannabis on the streets, which I completely recognise, and the normalisation of that being within people's purview.
Because I think there is a wholesale difference between people using cannabis for recreational purposes, which we've made illegal and is one debate. There is, when people are using medicines which we have made illegal and stopped the research for therapeutic purposes, that is a quite different issue.
I thank my own friend for the clarification. I think I may have used slightly limited. I think what I am trying to get at is for therapeutic use, there is still a required research standard. Yes. And whilst cannabis is ubiquitous and lots of people for non-therapeutic and currently not legal uses see, you know, if I quote Marshall Mathers III, marijuana is everywhere, where was you brought up? You know, but that does not translate into something that I feel I am comfortable in asking clinicians to engage with. If it's all right, I'd quite just kind of develop it. I think I want to just really highlight what if my honourable friend from Cannabis will take a mention, 5 years of blood, sweat, tears, I would imagine, literally, through medical school to achieve his title of doctor, and then taking the Hippocratic Oath, and I think it's worth actually for those of us that haven't gone through that journey, just listening to it. The original version, that's a bit dated now in terms of its language. I will use my power to help the sick and the best of my ability and judgment. I will abstain from all intentional wrongdoing or harm. And I think that touches on the point that my honourable friend from Penrith and the Border made. To avoid doing harm, you need some certainty to do it either way. And in the it's more up to date form from the doctors that University of Exeter take, for example. I don't pledge, but I pledge to do my best to serve humanity, caring for the sick, promoting good health, alleviating pain and suffering. Doctors are coming in wanting to do that. I don't think the blockage, as was referred to, is anything to do with intention or fuddy-duddiness, or I will care for all patients equally and not allow prejudice to influence my practice is another one of the lines that they say. And I think again, any doctor looking at a child as sick as Ben can be when his seizures are bad, having taken that oath, they're not going to go, there's something that I could forgive me for continuing to emphasise the point, but I think I will respect the autonomy and dignity of my patients. I will uphold their confidentiality. I support teachers, colleagues, all of those who stay in the NHS. And then it gets to this one. I shall never intentionally cause harm to my patients and will have the utmost respect for human life. I will practice medicine with integrity, humility, honesty and compassion. I recognise that the practice of medicine is a privilege, comes with considerable responsibility. I'll not abuse my position. This oath is the signifier of the integrity of individual doctors and medical ethics. It's their lodestone, at the core of what they do, and I agree with them that it needs to be protected at all costs. Each doctor needs to weigh his own decisions, but for these complex cases, especially for some of the people that have, by anecdote and a good old case of looking at, as I would put it, hugely benefited from medical cannabis. There's not one doctor in that system. There's a series of them, and whilst Ben has secured one NHS professor's support for prescription and one private doctor's support for prescription, I draw no distinction between the scale of the personal challenge and the qualifications that somebody has, regardless of where they work. But other medically qualified professionals who are within the CCG, within the funding panel, are saying we need more evidence before we can do this. Delighted to.
Thank you for giving way. And I think it's very important for people to remember that at various stages through medical evidence building, there have been occasions where people say very strongly, anecdotally, something is working, and yet further down the line we discover that that wasn't the case. And so there is a hesitancy when it comes to that kind of observational medicine in evidence in medicine, because it isn't reliable, I'm afraid.
I thank my honourable friend for his intervention, and if I don't embarrass him too much, may I also thank him for his service in hospital during the COVID pandemic as well. And I think actually it's the strength of experience and the variety of experience on these benches that makes sure that when we do put stuff through, that actually the laws of this country are scrutinised by people that come at this from different perspectives, and he's a great example of that. The position Joanne is in is she's coming to me with Ben saying, this doctor says he can have it, and then I've got another set of doctors saying, well, we need more evidence before we can prescribe it, and it's leaving a lot. No, just honestly, make a bit of progress. I hope you don't mind. I've been very fair. We've got a loving family in a state of limbo. We've got medical professionals that are deeply concerned about whether it is the right thing to do, whether it's breaking their Hippocratic oath to prescribe. And you have someone who is not qualified remotely to make this decision, being asked to, in effect, engage in a medical ethics debate when I'm not qualified to do so. But I just want to turn to another aspect of this. Madam Deputy Speaker, this may be the point where I have to declare my biology degree and a distinct possibility that this might get a bit nerdy. I apologise for that. But I think we need geeks may take over the world. But I think the examination of the other side of it, in terms of, okay, so how do the scientists, whether they're medically qualified doctors or not, how does science give the evidence base that gives the doctors some confidence and, cuts out all of the nonsense in this? So effectively, I'm asking the House is forbearant for the topic of standards of scientific proof. So just to recap, the families of the children, including Ben, believe, based on the evidence of their own eyes, a #1 eyeball, that medicinal cannabis has an enormously positive effect on the seizures, which are so distressing. I don't want to keep walking away and making this a theoretical concept, because it's not. And the family have secured the support of 2 different medically qualified individuals as well. But others on the other side believe that the scientific literature lacks the evidence base, as to the point that my honourable friend made, because we haven't got the evidence base because we made it illegal for 50 years and it only became legal 3 years ago. But we haven't got the evidence base to prescribe specific compounds and drugs. Now, there's not been enough research to understand formally in the gold standard of the double-blind trial whether these cannabis medicines do work. And I think in his opening speech, the Honourable Member for Withington talked about different formulations being available of this generic thing, different strains, different levels of THC, different levels of CBD, different ratios. And he talked about a trial and error process to get these very, very sick children and adults, a medicine that works for them and is stable. And I think in emergency and in extremis, if it was my child, I would want to go through that trial and error process. But as a scientist, trial and error can lead to really big problems, and we've got to find a way. It's not good enough to go, we think medical cannabis works, so tell you what, we'll give you 0.5%, or we'll give you 10%, or I don't know. Yeah.
Thank you for giving way again. And sorry, thank the Honourable Lady. The problem here is we have been here for many, many, many years having this discussion ad infinitum. The way in which the Honourable Lady is standing up today and painting this picture. Ben has had a medicine at every single possible licensed and unlicensed medicine already through the NHS. This is the only one that makes his life incredibly better. Not a miracle cure, but gives him a quality of life that he deserves. And so do these children. So whatever is anecdotal, there is more than anecdotal out there. And I think she's insulting the families by making this case today.
I think the Honourable Lady is being unfair. Yeah. I think if listening to my words, she will understand that I have that level of emotion about a very poor and sick child, but I am trying to find a way to help him that doesn't potentially put other children at risk because we're giving something on anecdote. Thalidomide was fine, may I remind her. I think if you step away from the, I can't hear the Honourable Lady chuntering at me from behind a mask. If she wants to insult me personally, stand up, please.
I wouldn't make a personal insult to the Honourable Lady because I don't think that this place is the place to do it. And I'll happily have a conversation with her afterwards. The issue that we've got here is that the word anecdotal is being thrown around. None of these experiences and none of the work has been done by a lot of the people involved is anecdotal. This isn't anecdotal. This is not about ethics. This is about the medicine getting to the children that need it because the situation is now intolerable.
The term anecdote is within a scientific concept, not statistically proven. And I think whilst the emotion that the Honourable Lady opposite is showing on behalf of this family and these families, I think it's important. I also think that it's important to step back and make sure that if this pandemic shows you nothing else, the power of science to find the right answers to solve problems. I'd be delighted to give way to one friend.
Thank you, Vicky. I think it's very, very important that we don't allow our compassion and our concern about individual cases to cloud our judgment about the fact that the NHS and the Department of Health and the MHRA have to put in place systems that apply to every medicine across all the many, many treatments we use, and there are questions like this repeatedly about many, many medicines, and we shouldn't be using one case and one example to change the whole approach that actually overall, as you've explained, is aimed at keeping people safe.
I thank my honourable friend, and if the bill from the member opposite kind of solved a specific problem, it could enjoy my support. Let me just make a little bit of progress.
Jeff Smith.
I'm grateful to her for giving me. She's making a very thoughtful and important speech, I think. I just want to go back to the comparison, the mention, rather, of thalidomide. I just think that is an unfair comparison. Yeah. Thalidomide went through all the randomised control trials. People have used cannabis for thousands of years. Nobody's ever found any evidence of any fetal abnormalities as a result of cannabis. Now, that's not through randomised control trials, and I understand where she seems to be coming from is that randomised control trials are the only way to get evidence. She may come back to correct my impression, but I just think that we need to look beyond that and think there is a whole wealth and body of evidence out there. And I'm no scientific expert, but that's why I'm proposing a commission made up of experts to look at the evidence to recommend a way forward. But I just think the comparison with thalidomide is not one that we should be making.
Catherine Fletcher.
I thank the honourable member. I think I make the comparison because that was an inappropriately researched product that had hugely deleterious effects because people weren't looking properly. Yeah. Now, I accept, and I'm happy to clarify for the record, that I am in no way suggesting that medicinal cannabis could have the same side effects as thalidomide. I'm still talking about the scientific method. Yes. Right. So just go on. Is this Sitting Friday thing's fascinating? Mr. Shannon, I would absolutely...
Jim Shannon.
The Honourable Lady, forgive me. The Honourable Lady refers to evidence. Sophie Gibson, the daughter of my constituents, has had medicinal cannabis use for 3.5 years. That has greatly increased her quality of life, has reduced her epileptic fits, has given her the opportunity to transcend from primary school to secondary school. In this year, her parents have a very, very strong evidential base that it works.
Catherine Fletcher.
I know her parents do, but as a scientist taking a decision on an N of 3, it's not possible. You know, the N being the number. You've got. Let me make a little progress because I'm trying to defend science, but I am incredibly conscious that there's a number of other people who want to come in to speak and have other perspectives on the matter. Look, there are august bodies, the British Paediatric Neurology Association, the General Medical Council, the National Institute, the Royal College of Physicians, and they've all issued guidance around the original change in the law, which was initially cautious. But NICE has recently updated its guidance, saying there is no recommendation against the use of cannabis-based medicinal products. But it's still not addressing the issue of positive evidence base for safety and effectiveness of these drugs. So how do we... sorry, I know my honourable friend has been waiting. Thank you.
Thank you. I thank the Honourable Lady for giving way. I just wanted to say, in response to some of the passions, I think the Honourable Lady is making an incredible speech that is not only emotional, but is outlining the difficulties of ethics, decision-making, science and research. And I've listened captivated for the last 30 minutes in the way in which she is presenting this to the House. And can I just say, on behalf of all honourable members here today, thank you.
I thank the honourable member. I'd like to reassure the House that it's not the surnames that we only have in common. So we need to talk to I think we're getting somewhere. We need an evidence base that's a scientific evidence base that we can prescribe to doctors or the system more broadly that will allow us to, will give them more confidence. Or we need, as the Honourable Gentleman suggests, a bypass mechanism effectively that says, I know we haven't got any evidence, but on this particular one we're going to have to look at, you know, very compelling but relatively small numbers. And I think it's probably the implication that we just throw out what's working very well. No, I don't. Look, so his point he makes, and I think maybe this is where he might welcome what I'm trying to get at, is the gold standard randomised controlled trial requires a very strongly controlled placebo. So you've got two cohorts of people. They absolutely do not know whether they're on a placebo or whether they're on the real thing, because there are a series of cognitive biases that can kick in if you think you're receiving a medicine and are not. And I 100% agree and understand why anybody whose child is currently taking medicinal cannabis and is stable and happy, you would never put yourself into the position where you would have a 1 in X chance of receiving the placebo as opposed to the medicine. I've spoken with Joanne Griffith directly about this, and I understand it. But that doesn't mean, you look at what we've done already or the scientific establishment has done already during COVID to change trial design, to change ways of doing things. And I think it has to be possible to find a placebo cohort that doesn't necessarily, out of children with similar conditions that aren't taking additional cannabis medicine. There are a number of reasons why people might not choose to use it, be that kind of personal endeavour or something else. The UK is not an island, because the other problem with these things is they are fantastically low in numbers, so there's a relatively low pool of people to play with. But the UK has shown itself to be a leader in global science, and I think it would be possible to find a placebo group in other countries where they haven't taken the progressive steps that we've taken in the UK to legalise medicinal cannabis, to find children with similar medical conditions and use them as the placebo. I think there is an opportunity for the scientific community to maintain that gold standard of a double-blind trial, but not necessarily put people in the position where they need to come across. So that would be my call to government, would be to speed the observation trials that are currently within there, and then to engage with scientific leadership. Remember, it's this government that's putting an extra billions into research and development because we are a science superpower. So it's to engage in a more creative RCT trial, looking for the placebo that proves or disproves it over a series of numbers on a global scale. I'm going to draw my remarks to a close, but it's the pincer of medical ethics and standards of evidence that tragically young men like Ben sit, and you can't see the distress without it. So there are potential solutions. There are measures in this bill that I do kind of see the sense about, but they come back to too much the idea that if I vote for this bill today, as an MP, as an unqualified individual, I'm going to have to tell a medical professional to do something. That's, but to be fair, how I read this bill. And whilst you can hear I'm a bit of a nerd, I'm very conscious others want to come in, so I'm going to carry on if that's all right. And whilst I am a nerd and I can understand the science, and I'm very happy to, I don't believe that I think it's shaky ground for elected individuals to get into a position where we are strongly incentivising the system to, or tell medically qualified people who have taken an oath what to do. I don't think it's possible for us to say, OK, I know we don't have any peer-reviewed evidence for that particular drug X on that percentage formulation can work, but the families say it does, I can see it does, so off you go and prescribe it. I don't, simply put, I don't think we can tell what to do. So it's with a genuinely heavy heart although huge commendations for the member opposite for getting this bill in front of the House today, and thanks to my honourable friend opposite for her passionate contribution. I know she'll continue to stick pins in me and make sure that I continue to work behind the scenes that I am. And I think that's probably my final message. My message to Joanne: I know you think I don't care. I do. I know you think I don't care. I do. I just cannot support this bill today. Thanks very much.
Andy MacDonald.
Thank you. Thank you, Madam Deputy Speaker. I confess to having been depressed many a time in this chamber, but after that last contribution, I cannot remember feeling as low as I do at this moment.
Take it seriously.
Please take this seriously. This is not in any way about telling medical practitioners what to do. Please read the bill. And the proposition opposite the argument around placebos, that we would somehow look to a cohort in some other jurisdiction for available children to participate, fills me with absolute and utter horror. But, Madam Deputy Speaker, I rise to speak in support of this bill, and in doing so I congratulate my honourable friend, the member for Manchester Withington, for his masterclass. If anybody needs to understand what members have tried to persuade this place about over the last many, many years, read that speech in Hansard. It is a comprehensive account. But we are here yet again, and again, with respect to the member from South Ribble, she's taken us back years in going back to the basics, to the very beginnings of this debate, and I regret that bitterly. But again, my honourable friend has brought forward this modest, focused and eminently reasonable bill, which I trust will gain the support of the entire House. I hope it does. The application of medical cannabis extends to and is of benefit to other conditions such as intractable nausea and vomiting, chronic pain, but it's cases of epilepsy that I want to focus my remarks upon. We've had many a debate in this place about medical cannabis and heard the incredibly moving stories from families about the wonderful efficacy of medical cannabis in response to severe treatment-resistant epilepsy. Early last month, we had an excellent debate in Westminster Hall secured by the Honourable Member for South Leicestershire, who spoke with such eloquence and forensic accuracy as to the veracity of these treatments, and from the Right Honourable Member from Hemel Hempstead, who has been a determined advocate in this campaign. But notwithstanding the most welcome change to the law to facilitate NHS prescriptions of medical cannabis, only 3 such prescriptions have been issued in the last 3 years since 2018, and as such, the parents of children with intractable epilepsy, knowing that the medical cannabis treatment they have procured works, with seizures much reduced or indeed eliminated, have been left at breaking point, emotionally and financially, having to find up to £2,000 a month to pay privately for this medicine. And there can be no question of those who have issued those prescriptions doing anything other than obeying their Hippocratic oath. But I can't think any of us can imagine how on earth those loving parents cope with such massive costs, up to £2,000 a month. That's the equivalent of an additional and very substantial mortgage. In fact, it would dwarf many people's mortgage payments. Not even we MPs on over £80,000 a year could cope with that. How on earth can we expect those families to withstand those huge costs, simply trying to keep their children alive and free from the ravages of seizures by accessing a known and proven prescriptive solution. That these families cannot secure NHS prescriptions for their children when it has been proved beyond any doubt that cannabis is efficacious is a monumental shame. The campaign group End Our Pain rightly said that this saga has dragged on for far too long. Those families have petitioned, marched and campaigned with such dignity. They should not and must not be ignored. The new Secretary of State for Health and Social Care was pivotal in the change in the law when he was Home Secretary, and I urge him and the Minister and the Department to give effect to that change and remove all barriers to getting medical cannabis to those patients. This bill makes an invaluable contribution to increasing prescription capacity by very pointedly freeing up one of the blockages in getting these vital prescriptions to the people who desperately need them and who so evidently benefit from them. It is a simple bill, Madam Deputy Speaker, with a mere 3 substantive but very precise clauses, the overall effect of which is to firstly require the General Medical Council to operate a register of general practitioners who may prescribe cannabis-based products in England, changing the position from prescription only by consultants. It also requires the GMC to set the criteria to include training and professional development requirements to enable GPs to be on the register. It is up to each GP to decide whether or not they participate. But the second limb of the bill establishes a commission to bring forward a framework for the assessment of cannabis-based medicines and their suitability for NHS prescription, and tasks such a commission with recommending measures to overcome barriers to gaining access to cannabis medicines on the NHS. I'm sorry that the last speaker is not able. My honourable friend has made provision within such a commission for the careful consideration of evidence other than from conventional controlled trials, including from observational studies and from other countries where cannabis-based medicines are more readily prescribed. This is not some licking of a finger and sticking it in the air. This is about proper research upon which we can rely. We've heard it explained to us how randomised trials are not the appropriate way to go about this business, and in any event, it being held out as the gold standard is certainly open to debate, Madam Deputy Speaker. I'm afraid that the mantra of conventional random trials is simply inhumane. We have a situation here where patients and their families know that this works, but the current system is trapped in its inflexible and flawed processes that so badly fail epilepsy sufferers who have to mortgage all that they've got to pay for these prescriptions or continue to suffer the ravages of seizures and often some dreadful side effects of powerful drugs. This bill is a careful step along the way of addressing one small part of the blockage to sufferers getting the right treatments. Madam Deputy Speaker, I somewhat belatedly must declare an interest here, as I do have a 26-year-old son with epilepsy and severe developmental delay and special needs as a consequence. And I would like to explore further whether medical cannabis might be of assistance to him. But hitherto, the system is as resistant as the condition itself. He's had 2 older brothers, one of whom we lost when he was just 16 years old, 15 years ago. Colleagues will have heard me mentioned him before. But I don't know whether medical cannabis would have helped him, had we even known about it then. But I will do everything I can to assist families right now in their determination to get the medication that their children need. We were confronted with our beloved Rory locked in status, and I recall so vividly calling the ambulance and having him whisked off to hospital, where the consultant told us that we'd better call a priest. And then for all of us, my wife, Sally, my son, Paddy, and my daughter, Rosie, holding Rory as he died. I never want to have any of those families suffer such an outcome. I just bitterly regret that I have not shown the courage and the determination of people like Hannah Deacon in securing that medication for her child. Oh, how I wish I had been as wise as she. So I beg, honourable and right honourable members, not to talk this bill out today, as they've been instructed to do, but to do the right thing and help taking this small step today to help remove one of the barriers that are placed in the way of people so desperately in need of these treatments, and give them access to this life-changing and indeed life-saving treatment. Thank you, Madam Deputy Speaker.
Yeah. Natalie Elphick.
Thank you, Madam Deputy Speaker. I'm extremely moved and saddened by the honourable member for Middlesex comments, and my great sympathies to him and his family. Good wishes to them. This is such an important topic to be discussed today, and I thank the honourable member for Manchester Withington for bringing his private member's bill forward. It affects many people up and down the country, adults and children alike. I welcome the opportunity to speak in today's debate and would also like to focus my remarks on epilepsy and children. I have a constituent, Tegan Appleby, who has been mentioned earlier. She is one of the ones who cannot access medical cannabis on the NHS. Tegan is reliant on medical cannabis to manage her epilepsy so she doesn't suffer hundreds of fitting episodes. I pay tribute to Tegan's mother, Emma, for her superb care of Tegan. It is simply unfair and unacceptable that in addition to looking after Tegan, Emma raises thousands of pounds each month to get hold of Tegan's medicine. That shouldn't be the case. That's what our NHS is there for. The law was changed by my right honourable friend, the Secretary of State for Health and Social Care, when he was then Home Secretary. But too many people simply can't get an NHS prescription in practice, even after the law has been changed. Tegan's case was one of the first constituency surgery cases that I worked on after being elected in December 2019. As is the case for many members representing children who have epilepsy and need medicinal cannabis, this has gone on for many years, too many years. Many members have worked hard to secure access to the medicine, and I pay tribute to them for all of the work that has been undertaken. I attended the debate here just over a month ago on Thursday, the 4th of November, on this topic, which followed the Westminster Hall debate on the 3rd of November, to which the Honourable Member for Middlesbrough has referred. That narrower topic of the situation for epileptic children was explored there. Looking at my own experience in pursuing the situation for Tegan, I had fully expected that this would be one of those cases of where there's a will, there's a way. I'm sorry to say that hasn't been my experience of the NHS in this case. Instead, it seems to be where there's no will, no one will pay. And I don't mean political will. As has been set out time and again in this place, the political intent is clear and I truly believe is cross-party. I was present when my honourable friend, the Minister for Primary Health, said last month, "The Health Secretary and I are committed to doing everything within our power to accelerate this work." I have spoken to her personally about the sad situation which affects Tegan, and I have absolutely no doubt about her and the government's resolve on this. Indeed, she said further, "We have changed the law, but that is clearly not enough. We need to find a resolution so that we can get these medications licensed if the clinical evidence is there, and we need to work with the regulator." I agree with the Primary Health Minister that the law has changed and that it is not enough. It's not enough to ensure that Tegan gets the medicine she needs on the NHS. My own experience in pursuing the matter as a constituency MP has highlighted that the blocks and barriers in helping Tegan are those which I have seen firsthand, and I'm sure many of us have, in many other cases within the NHS and how it operates. But these are harder to overcome because of the speciality in dealing with both children and specialised medicine in a shared care environment. This is one aspect which Clause 1 of this bill is seeking to address. Let me expand on that further. Medical cannabis can be prescribed on the NHS. The changes have been made in November 2018 to legalise this position. While the drug itself is unlicensed, or the class of those particular drugs, it is not unlawful. Plenty of medicines and treatments can be prescribed on the NHS that are not licensed drugs. Indeed, I recall once reading that exercise might be available to be prescribed on the NHS, but I'm not sure whether that is the case. Certainly, I have been able to locate that the National Institute for Clinical Excellence has approved the funding of the Alexandra technique for Parkinson's disease, as well as ginger and acupressure for reducing morning sickness. This particular drug, cannabis, is illegal, and I support that position and fully oppose a relaxation or general legalisation of cannabis. The same is true of morphine, which illegally is heroin. I support that position and fully oppose the general legalisation of heroin. However, I have myself needed morphine in hospital and have been utterly and profoundly grateful for the relief that it gives, and other members today may have had the same experience likewise. I am mindful of that, and that's why it's so vital that we find a way to support Tegan and those like her who need access to the medicine that works for her. That support is twofold: money and prescribing. I'm afraid it can't wait for the outcome of years of medical trials or the vague hope that some company will want to invest in developing further research in this area, because this is an issue that affects, in numbers, relatively few children, but in impact, it is utterly profound to their quality of life and their condition. Now, of course, medicines need to be to the highest standards, and there mustn't be a question of opening Pandora's box to legalising cannabis through the back door, and I know some members are concerned about that aspect of this debate. That is something which will need to be explored further at committee stage to ensure that this bill is entirely robust. But for me, the question is this: how do I help Tegan and other children like her get the support that she needs paid for by the NHS? Clause 2 sets out that a register may be kept of prescribing GPs. At the present time, I think there must be a real concern that the terms and conditions, what's described in that clause as the criteria and training element that are set out in the bill, may not resolve the problem faced by Tegan, and a number of members have referred to the hesitancy within the medical profession about some of these issues, and recognise the immense speciality that these issues bring. But let's suppose her GP is willing. Currently, the money to pay for prescriptions would need to come from the area's clinical commissioning group or the main NHS funding for exceptional medicine. I have tried both of these sources for Tegan without success. I've ended up in a perpetual loop, essentially that this isn't an approved medicine, so it won't be funded, even though it's a legal medicine that can be prescribed. Turning to prescription, some specialist consultants do not accept that this medicine works, even though for those families who have children who take it, it clearly does. Tegan's mum knows it works. That's why she tirelessly, month after month, year after year, gets the money by fundraising to help her daughter get the medicine that she needs. If Tegan doesn't get the medicine she needs, she gets iller. If she gets the medicine she needs, she is better. Sometimes the particular type of medicine she needs has to change in order for it to remain effective. Then it is changed, and then she is better again. That seems to me to be unquestionable and reliable evidence that can be found in Tegan's own medical records, including when she is hospitalised, when she is on occasion. I am mindful of my honourable friend for Crewe and Nantwich comment on this, but I would suggest that this is documentary and professional evidence when it takes place within the context of Tegan's medical records. These are prescriptions that are being given for this medicine. And as such, I don't think it is correct, as has been suggested by my honourable friend for South Ribble, that this is simply observational, recognising that she is referring to it in a scientific context. But here in this place, we are having a debate, as she said in her own words, that people can communicate with and understand. And these are not observations of Tegan's family or of Tegan. These are clinical records and notes in her formal medical records. And I would like it to be explored that some of that evidential base that is needed is looked at in those few but really, really well observed and documented cases where children are using this particular medicine. Yes.
Thank you. I think one of the things we have to understand is that it's not just about whether a treatment works for a particular patient. There are lots of treatments that work, but with greater study and better understanding, we realise there are lots of side effects and problems that might crop up with smaller numbers of patients that can be devastating. So I think we just have to be careful when we're talking about what we mean when we say a treatment is effective. You know, we've all just gone through a period of getting a vaccine approved, for example, that we know works, but we also know has very severe side effects. You have to balance a bigger picture than just what happens with any one individual patient.
I thank my honourable friend for his intervention, and clearly he has a lot of practical experience in medicine. And as I have mentioned earlier, this is an area of very much a specialist area in both the medical cannabis and for the children. But I would say this to him, that it would be perverse indeed if on the one hand people might be ordered perhaps to have a medicine that they don't want. And I note he raised the question of the COVID vaccines and that research. But on the other hand, people are prevented from getting medicines that they want and that they know that works. And I think that that's what we are seeking to address here. Yes, of course.
And my honourable friend is making a very powerful speech, and I asked this question on the basis of developing my own knowledge of this subject, because based upon what my friend from Manchester Withington was saying in terms of the two-stage process for being referred for treatment, there is the clinical referral and then there is the CCG who consider that. Now, could I ask, in the case of Tegan, that is the clinical referral, but it is the CCG that is the blockage. And if that is the case, is that clinicians at the CCG level or non-medical qualified people who are making that decision?
I thank my honourable friend for his intervention. As I referred to just a short time ago in my remarks, that is the perpetual loop, that essentially it isn't an approved medicine, so it wouldn't be funded, even though it's a legal medicine that can be prescribed. And that prescription element is the matter that a number of honourable members who have considered this issue find to be particularly challenging, because the hesitancy and the expertise that have been mentioned today mean that the pool of people who might be able to prescribe this on the NHS is not a large one. And I think that's very much driving the suggestions in the bill today that the honourable member for Manchester Witherington has made. So, and turning to the question of professionalism, because I think that has come up on more than one occasion today, I do think it is worth just recording that prescriptions, private prescriptions by qualified GPs are being given by qualified specialists in this area. So it is the case, as with so many areas of medicine, and those who are doctors will know this better than any, that different doctors do think sometimes that different medicine works for some patients and different for others. And so it is important to note that this is professionally prescribed private prescriptions. The issue is that these prescriptions are not available where they are needed on the NHS. So it is about the drug being funded, and that's the matter I just wanted to just move on to. So, going to that issue of why it might not be funded because of the status of the medicine and the licensing, I have heard that my honourable friend, the Minister for Primary Health before, referred to the licensing tests of quality, safety and efficiency. And these are very important tests. I'm sure on all sides of the House we would agree. The quality of the medical cannabis and effectiveness of it in these very few cases that relate to epileptic children can be satisfied. These are obtained by private prescriptions and obtained openly through the medicine, through recognised channels. As I've said before, and I do want to emphasise this for particularly the members on this side of the House, this is lawful to do so, and this is lawfully prescribed medication by doctors. It is NHS prescribing that is the barrier. Turning to safety, there is always a risk with any medicine, as well as the risk in having a medicine, as well as the risk in not having that medicine, both with the medicine itself and with weighing up the consequences of not having the medicine. A professional doctor and those involved in medical care will look at both. What happens if you have a particular medication, and what are the potential risks, and what happens if you don't. Well, in this case, not having this medicine results in worse health outcomes as well as a worse quality of life for Tegan. And if the Alexandra technique, acupressure and ginger can be funded on the NHS, it should be considered whether the right bar is being set for Tegan's medicine to be funded too. The Honourable Member for South Ribble has mentioned the speed of the COVID vaccination getting its regulatory approval, a pace and speed we have not seen with medical cannabis. Some of the acts that we do in this place, their effects can be measured in centuries, and the Environment Act is a really good example of that. And I know later today we will be moving on to discuss the climate change more generally. But some of the decisions that we have to make in this place can impact on lives in days and months and years. And I would suggest that this is one of them. This is a situation where the government has authorised this medicine to be available. That decision has been taken. This is about completing the journey so that the intended effect of ensuring that where it is clinically appropriate, where it is in the best interests of that child, a child can be treated with the right medicine for them under the correct supervision, and that medicine is funded on the NHS. Tegan Appleby needs medical cannabis to improve her serious health condition. Without it, she suffers from fits. With it, she is so much better. That's why I support the prescription of medical cannabis on the NHS for little Tegan and the other children who so clearly need it. I pay tribute to Tegan's mum, Emma. She has been a tireless and energetic campaigner on behalf of her daughter to get the medical treatment that she needs. Madam Deputy Speaker, I close by thanking again the Honourable Member for Manchester Withington for bringing forward this bill, and the Minister for her attention to Tegan's case and this matter.
Jim Shannon.
Thank you, Madam Deputy Speaker. First of all, I can say what a pleasure it is to follow the Honourable Lady for Dover. I wholeheartedly, as I think others do, agree with her point of view, and I referred to her the way she put it, completing the journey. I think that's what we want to do today, complete the journey, so we can get to where we want to be. I would like to commend the Honourable Gentleman for Manchester Whittington for bringing it forward today as well, and I'm so very pleased to see this coming for the House. Can I commend the Honourable Gentleman for Middlesbrough for his personal story? I think the personal story emphasises in this House how important it is to get to the end and have this bill passed. So I commend them. I know that was hard, by the way, and it was hard for us because we sympathise with you and where that is. So thank you for sharing it, and thank you for giving that force of personal experience, which I think makes a difference. Madam Deputy Speaker, I thank very much for being able to have the opportunity to speak. I won't detain the House long. I intend to keep my comments very concise in relation to where I am. I'm going to give one example. I'm going to tell a story, and that's what I'm going to do, and I'm going to leave that with the House. I'm well known in this chamber for advocating, along with other members, and they're all sitting here, for advocating for medicinal cannabis under specific circumstances. I fought furiously for young Sophie Gibson in Newton Ours to get the medication which our parents knew could make a difference for that sweet little darling of a girl. The following note is from her mum and dad, who fought night and day for their child, who went to Holland to live, as others have referred to, and fundraising, did all of this alone and in desperation. To me, I believe this underlines the battle faced by parents throughout the United Kingdom of Great Britain and Northern Ireland, and why I am supportive of access to medicinal cannabis in certain circumstances. It's not, as the Honourable Lady for Dover referred to, it's not universal allocation or prescription of medicinal cannabis. It's specifically for those who it can help from a medicinal point of view. And that's what we've always said. To me, maybe I look at things very simply, but that's what I see this bill about today. So that's why I'm supportive. And I want to quote, and I'm not going to take too long to do so, but I just want to quote the parent's story. 3 years ago, our lives were changed when Sophia received the great news that she would get her whole plant medicinal cannabis medicine via an NHS prescription. The expert panel was set up to help children like our daughter, but was quickly scrapped. 3 years ago, the law surrounding medicinal cannabis was changed, but nothing has changed since. There are still only 3 whole plant medicinal cannabis NHS prescriptions in the United Kingdom. And we ask why. When this marvellous medicine has kept our daughter out of hospital for over 3 years, has improved her life immensely, kept her seizures the most controlled they have ever been in all her young life. Some say this is classed as anecdotal evidence. I say it's not. I say it's real evidence, as the Honourable Lady for Dover referred to, and as the Honourable Gentleman who introduced it also said. We can see, and I quote from the parents, "We are with Sophia the most and see the difference. The hospital records speak volumes that Sophia has not needed to avail of ambulances, of A&E visits, and hospital ward visits for over 3 years." Is that not an evidential base of change that makes a difference? And I respect people of much more medical and health understanding than I have, Madam Deputy Speaker, and I understand that. But I see evidence from my constituents over 3.5 years. These are the facts. Why can't other children and adults avail of this medicine via NHS? Why has it become a two-tier system that if you have the money, you can avail of it? Or why are so many forced into fundraising, selling their personal belongings, or taking loans out just to keep their loved ones safe? Honourable Gentleman referred to it. Imagine every month having to add over £1,000 to your essential bills for a medicine because That is exactly what some families are forced to do. Being so scared that if you don't have the money, what will happen to your child? That's the reality for some in the United Kingdom today. We know we are blessed and so fortunate to have an NHS script because we know we couldn't afford that money each month for a private prescription. We thought, and I'm quoting from them, 3 years ago, that after the 3 prescriptions, many more would follow. And what a letdown it has been. Soul destroying for us because you feel bad because we have an NHS prescript and others don't. So why do our loved ones need to suffer, whether it be physically, with seizures, or mentally, and the loved ones that have additional stress? 3 years after a standstill when we have some of the best resources, doctors and health service in the world, and I pay tribute to our NHS and everyone involved. We all recognise so much, and in this House we're very pleased and privileged to have those who make a contribution every day. We could have been leading the way, but instead we are stalling, passing the buck with no answers and resolutions for these families. How many more lives will be taken or be at risk before they can get the medication they want? That's what the Honourable Lady said, and that's what I endorse as well. Families have enough stress and worry about having to do all this. We hope someone, somewhere in this House truly listens today and can have the answers for us all. That's a wee summary of Sophia's story. Sophia hasn't been in hospital since July 2018, 3.5 years ago. Her seizures have reduced dramatically and managed at home as they are so brief. The change is almost miraculous, and yet families throughout the UK are forced into the 2-tier system that if you can afford a private script to help your child, you can have it. Sophia's parents have said, we know we are blessed, and they are, and so fortunate still to this day, do not know why Sophia's consultant had a change of heart. But he had, and my constituents today benefit from that. The courage to stand out from the crowd, to take a chance on the only medicine that has helped Sophia. This year marks the end of Sophia's time in primary school and transitioning into high school next year. Did Sophia's parents ever think that would happen? There were times they thought they would never see the day, Madam Deputy Speaker, as they thought on many occasions they would lose her, but they and we thank God every day that our neurologist prescribes it in Belfast. The whole plant medicinal cannabis worked for their precious little girl. We just need other NHS neurologists to listen and take the chance and give all those loved ones a chance at a better quality of life. I understand that people have a different point of view, and I always respect other points of view, even though I may not agree with them. But I would urge those who are not convinced yet, and I look to the Minister, and I have great respect for the Minister, you know that, personally, on a personal basis, but also as Minister. And I would suggest that today we've got an opportunity to change lives in this House with something that I have seen makes a difference. I conclude with this, Madam Chair. Nothing I could say could explain it better than Sophia's story. And that is why I stand today for Sophia Gibson's story as it is, and also for the families of Georgia and Dundalk, my colleague for East Belfast family, have the chance at a new life that they need for their child, like we Sophia. Again, I commend the Honourable Gentleman for Manchester and what he did for bringing this forward. I would implore, I think all the people said I would beg if it takes that to beg to make the change. Make it happen today, Madam Deputy Speaker. It will save lives, it will lift the quality of lives, and it would be, I believe, an answer to prayer. Thank you.